Sometimes the smallest changes in our bodies can be the most telling indicators of something serious, like cancer. But with everything going on, it's easy to overlook those signs. So, what are those subtle symptoms most of us tend to ignore that could potentially save our lives?
That's a fantastic question, Luna. It's crucial to understand these signs early on, because catching cancer in its early stages can significantly improve treatment outcomes. Let's start with unexplained weight loss. It's such a common symptom, but often ignored. Many people think shedding pounds without effort is a bonus, but if you're losing more than 10 pounds unexpectedly, it might be an early sign of cancers like pancreatic, lung, or stomach cancer. These cancers can speed up metabolism drastically.
Yes, exactly. There's so much happening inside our bodies that we don't consciously realize. Persistent fatigue is another big one. Everyone feels tired now and then, but when you're consistently drained despite getting enough rest, it might be worth checking out with your healthcare provider. Fatigue in combination with other symptoms can frequently occur in cancers like leukemia or colon cancer because the body's resources are being directed towards fighting an illness.
Right. It's a signal not to be ignored. Then there's a fever that won't go away. Often dismissed as a stubborn cold or flu, but persistent fevers might indicate cancers, especially those affecting blood, like leukemia or lymphoma. This happens because cancer can trigger the immune system, causing a more persistent fever.
Absolutely. And chronic pain, such as headaches or persistent backaches, is another area to be wary of, especially if they don't subside with typical treatments. Persistent pain can sometimes be due to tumors pressing on nerves or parts of the skeleton.
That's so true. Skin changes beyond moles should also be noted, like any shift in skin color, jaundice, excessive itching, or unusual hair growth. These might suggest skin cancers or indicate internal cancers affecting liver function, perhaps due to bile duct obstruction or liver metastasis.
Changes in bowel habits, such as prolonged diarrhea, constipation, or changes in stool consistency, might also be signals. A lot of people attribute bowel changes to stress or diet, but these could indicate colorectal cancer, especially if they continue without explanation.
Exactly, Luna. Difficulty swallowing can be another sign. If you frequently struggle to swallow or feel like food is stuck in your throat, it might point towards esophageal or throat cancer. This occurs because growing tumors can constrict the esophagus and make swallowing difficult.
Speaking of things we might dismiss, a persistent cough or hoarseness is another. We've all had lingering colds, but a continuous cough could be linked to cancer of the lung, throat, or thyroid. If it persists for more than 3 weeks, see a doctor.
Unexplained bleeding can be alarming. Blood in urine or stool, or irregular vaginal bleeding, can signal cancers like kidney, bladder, or uterine cancer. These symptoms occur as tumors invade and damage nearby tissue and blood vessels.
Hey there, TTH family. Remember, if this information is hitting home and you want more tips and insights, give us a thumbs up, subscribe, and share with your friends. This helps more people stay informed and alert to these life-saving signs. Let's make health a priority together. Back to you, health heroes.
Thanks, Alex. It's always a bit more fun with your reminders. So back to the symptoms. Lumps and thickening in any part of the body, such as the breast, neck, or underarms, need immediate attention. These lumps could be benign, but they could also signal an early stage cancer that's developing.
So lumps are often key indicators, absolutely, and changes in the lymph nodes, which we might notice as swollen but painless areas, can suggest lymphoma or other types of cancers, such as breast cancer that has spread.
Sudden vision changes without apparent cause might hint at brain tumors, especially those putting pressure on certain parts of the brain that control vision or eye movements.
Indigestion or persistent heartburn shouldn't be ignored either. It's normal to get these symptoms once in a while, but when they persist over time, they could indicate cancers of the stomach, esophagus, or even throat. This persistence occurs because tumors can block digestive transit, or acid reflux worsens due to pressure changes in the abdominal area.
And another quick pit stop from me. Don't forget to comment below with any questions or experiences you want to share. We love hearing from our community. Engaging helps not just you, but everyone seeking better health knowledge. All right, let's get back to more life-saving chat.
As you said, Susan, changes in urinary habits like increased frequency, painful urination, or even a change in urine color might indicate bladder or prostate cancer. This is because a tumor might impact nearby structures or bladder control.
Sores that won't heal, whether it's a sore on the mouth, a skin lesion, or an ulcer in the genital area. If it doesn't heal, it could very well be a sign of cancer. This happens when cancerous cells disrupt normal healing processes.
And white patches inside the mouth or white spots on the tongue can be early indicators of oral cancer, often linked to tobacco use or alcohol consumption.
Persistent heartburn is worth that second mention, Luna. If lifestyle changes and over-the-counter medications don't help address it, a medical follow-up is warranted because it could signal cancers in the digestive tract.
Plus, unusual bleeding or discharge, as in spitting blood or finding blood in other excretions, might suggest severe conditions such as lung, colon, or cervical cancers. It's the body's way of showing something isn't right internally.
And then there's feeling full quickly without having eaten much, which might indicate ovarian cancer or related abdominal issues. This may occur due to tumors exerting pressure on surrounding organs, affecting appetite and digestion.
With all these symptoms outlined, Susan, what lifestyle changes can help us not reach these points?
Great point, Luna. Maintaining a balanced and healthy diet is fundamental. Choosing meals rich in fruits, vegetables, whole grains, and lean proteins can mitigate the risks associated with various cancers due to their antioxidants and fiber content.
Absolutely. And regular physical activity is another vital part. Exercise helps maintain a healthy weight and lowers the risk of colon, breast, and endometrial cancers by affecting hormone levels and improving insulin regulation.
Avoiding tobacco in all forms and limiting alcohol intake are crucial steps as well. Nicotine and alcohol have both been directly linked to increasing the likelihood of several types of cancer, and reducing can drastically diminish those risks.
And then there's sun protection. Skin protection through sunscreen application and wearing appropriate clothing when outside can reduce skin cancer risks significantly, especially during peak sunlight hours.
Vaccinations like those for HPV and hepatitis B are proactive measures against certain virus-induced cancers, such as cervical and liver cancers. These preventive healthcare services are often overlooked, but are powerful tools in cancer prevention.
Regular health screenings are key to early detection. Tests like mammograms, colonoscopies, and skin checks can help identify cancer in its earliest and most treatable stages.
Knowing your body and monitoring any unusual changes can aid in early detection. Awareness is half the battle and makes a substantial difference in health outcomes.
Don't underestimate managing stress either. Chronic stress can weaken one's immune system and disrupt hormone balance, potentially increasing cancer susceptibility. Practices like meditation, yoga, or even simple breathing exercises can help in maintaining psychological well-being.
Emotional and community support are essential too. They provide not just psychological backing, but often practical advice and shared experiences that can lighten the burden and guide through confusing symptoms.
And to wrap things up, thanks for tuning in, everyone. Remember to subscribe to the Health, hit that bell icon for notifications, and share this video with someone who might need this information. Your support keeps us going and ensuring we bring you all the best health insights.
Thank you so much, Alex, and thank you all for watching. Remember, staying informed and proactive about your health can make all the difference. Don't hesitate to reach out to health professionals if you notice any of these signs.
Stay safe, stay healthy, and see you in the next video of To the Health.